Welcome to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Each 10-minute episode features conversations with our authors on translating their research findings into practical and policy recommendations that will ultimately improve patient, community, and population health outcomes.
Welcome to a new episode of the JCIH podcast, Health and Communication Distilled, a podcast series from the Journal of Communication in Healthcare, Strategy, Media, and Engagement in Global Health. My name is Sheyla Finkelshteyn, and I'm the current Communication Technology and Social Media intern for spring and fall. Today we have with us Dr. Michael Robert Haupt and others. I'll let you guys all introduce yourselves really quick.
I'm Staci Weiss. I'm a postdoc at University of Cambridge, studying fetal development and pregnancy, and also did a study on how COVID related to maternal mental health and infant development during lockdown.
Michelle, I recently just ascended late last year, from Temple with my PhD in psychology. Right now I'm working at CHOPS, so Children's Hospital of Philadelphia, as a data analyst on their data insights team. So mostly helping out with strategizing, fundraising for CHOP and for the hospital.
And I wanted to add for myself that I'm still actually a PhD candidate, so not doctor yet, but getting there. But a PhD in cognitive science, and my research interests in general are social media or social network analysis and misinformation spread.
All right, thank you so much. So we will be discussing the journal article, Psychological and Situational Profiles of Social Distance Compliance During COVID-19, which we published online in March 2022. So hi, everyone, and thank you so much again for being here with us today. You already introduced yourself a little bit, so that's really great. Now, could I have you guys summarize a little bit what this study was about, maybe, and then we'll start with that?
Totally. Yeah. So I think on like a super high level, the methodology is related to like user experience research. So typically this type of persona work is used for like if you're a tech company and you kind of want to have like, instead of like a super abstract idea of like, you want to have a more solid notion of like who you're designing a product for. So typically these persona methodologies would be used essentially to also characterize different types of people who are, or like different personas of people who are quarantining for COVID and like trying to capture the different styles and also the variants related to that. And by doing that, we're also able to look at some of the differences of the motivations for why some people might do more risky behaviors versus others. Is we want to look at both individual dispositions of people. So just kind of how they're kind of just, how they kind of process the world in general. So we looked at empathy levels. We also looked at some personality traits, like so levels of introversion, sensation seeking, and the idea of like, if someone needs a lot of stimuli, then being quarantined is going to be a lot difficult, different type of experience than someone who is fine with not having that much sensation, essentially. But then also we wanted to account for, situational factors as well, because regardless of how someone might be, kind of wired or how they process the world, if you're in a situation where, for instance, like if you're in a 5-bedroom, mansion house with a pool, then being locked down in quarantine is going to be a very different type of quarantine than if you're in like a studio apartment and you don't have like a physical outdoor space. So that was kind of the main kind of motivation for the project in general, is like, can we combine these both dispositional variables and situational variables, and then use this persona methodology to get a more nuanced take of like how different people are reacting to COVID.
Yeah, super cool. All right, so the first question is, how long have you been working on this topic of psychological and situational profiles, and what inspired you to start this research?
So I've always been kind of just interested in just general, like, how do people react in different situations? So that's always been something I've been interested in. And then for the persona methodology more specifically, I was exposed to it before I started my PhD program. I worked in a market research firm. This type of methodology is used a lot for clients. So that's actually where I was exposed to it for the first time and learned how to do it. I've been friends with Staci since high school. And she's also, finishing up her PhD in psychology, at Temple, and not to steal her thunder, I'm sure she'll go into more detail a little bit later. But we were kind of just talking and we're like, oh, let's I have this methodology, and she was also, kind of already working with this study with Michelle as well, or basically collecting variables with it. So we were like, oh, let's try to combine it and see, kind of what comes out of it. And I'm very happy that we did.
Yeah, I won't say much because I think I'll actually let Michelle take over and talk a little bit about how we started working together. But I will say that most of my work had focused on neuroscience and imaging and, in general, tactile interactions, whether with other people or devices, robots. This kind of spanned my PhD.
Yeah, so I think part of what Staci and I had already been working on was looking at smartphone, mobile technology engagement, how young adults in college engage with their phones and how that relates to kind of how they regulate their behaviors, their actions. And so with like including risk-taking, risky behaviors. So when COVID hit, it was kind of like we wanted to try to pivot a lot of the questions that we had, sort of both the context and the questions themselves didn't really apply anymore because of the drastic shift in situation. A lot of people, shifting back home, everything became online. The digital shift was very dramatic, and a lot of kind of existing, and Michael sort of touched on this earlier, a lot of existing behaviors like going to the grocery store is now considered high risk and sort of only done if it's highly necessary. So that was kind of our big motivation for trying to see in the situation that happened as it was happening, how it was affecting people, especially since our original questions, obviously they shifted to with the onset of the COVID pandemic.
Wow, you guys, first of all, thank you. I also wanted to comment on how impressive I think it is how well you all pivoted together and really made the best of the situation. Really,
It
really
was
great.
quite a whirlwind in March. This project kind of went from didn't really, I mean, it was already, a very different type of project initially. And then in 2 months, we were just like, oh, how did we create a paper?
But actually, I think COVID was great for that because as grad students, we often have incredibly slow ethics procedures. You have to ask your supervisor, you have to have input from every angle, which is excellent and necessary kind of protocols to keep participants safe and to keep psychological science high quality. But when something like this happens, you see your role and you see your kind of purpose differently through everything that's happening around you. And I think it was kind of a call to action to all of us. In addition to our various imposing deadlines and this question of for me, I was like, is neuroimaging a career anymore? Will it ever be a career? What happened? Will babies wear masks when I bring them into the lab? This felt very critical. So I think we all took the call to action.
So shifting gears here a little bit, I personally study empathy. It's a concept that I'm really interested in, and I'm also a PhD student. And so I was kind of curious to hear from you all, what was the role of empathy, or what is the role of empathy in the study, and how do you see it play a role in general?
So I think in general, I mean, we did find, and we did run some multiple regressions where we did find that empathy was correlated with more compliance with, these COVID risky behaviors. So there definitely was at least an effect that we were able to detect. And that being said too, and I think what another strength of the persona approach is that we definitely see from a, traditional analysis, we do see that okay, there is a effect, but because the personas allow us to also see interactions between other variables too, that we're also able to see that while empathy was important, we did, at least based on the personas, that it does seem to be that the situation that people are in are actually a little bit more overriding than their kind of more empathetic tendencies. But in general too, I think for public health research in general, or even kind of anything healthcare, medical related, that it seems kind of psychometrics kind of get kind of pushed on the wayward side, where maybe more traditional demographics, race, gender, age kind of get more of a focus. But especially for health issues that require such a social element of it, I mean, literally it's social distancing is the phrase itself, that traits like empathy, for instance, are, I think, very worthwhile and definitely can have some notable impact.
Yeah, it's definitely a really useful approach to think about traits in this way, I think. And when it comes to traits, what are some of the barriers that individuals may experience in developing these types of traits and improving their compliance with social distancing, etc.?
I don't know, I guess considering empathy as even just a trait or just a variable that's worth considering in the first place, I think is definitely a good first step. And I think also and this is a little bit of a tangent, but I think the methodology in itself also kind of encourages empathy, even just for people who are even just like reading the article, in the sense that like the entire purpose of a persona is that like if you're developing a product, a service, or really just any type of output, you want to basically be able to empathize with the people who would end up using it. So it's like, it's definitely a lot easier if it's like, okay, this is like Greg and he's 30 and these are his hobbies and stuff like that. And you can then you can understand his situation and then, design something around it. So I think even with, especially for like public health crises, I think having, even from the policy level, and whether it's a public health official or anyone who's kind of in that, type of position, I think there is a lot of value of even just kind of understanding where the public is coming from, and, kind of understanding why people are acting the way they do. But yeah, Staci, Michelle, do you guys have any other thoughts on increasing empathy?
I mean, I think what was interesting about the study is it called for a very different kind of empathy to social distance than what we're used to, right? To be away physically was the compassionate, empathetic thing to do. And you had to be empathetic with the most vulnerable members of society, very old people, and the kind of people who we see all the time and interact with but take for granted, essential workers, in order to do this kind of social distancing behavior at your own expense. So it's not this kind of, oh, I understand your feeling. It's that I understand that my actions may in turn affect someone else and my own, the people around me. So this kind of collective call for consciousness and changing behavior at personal sacrifice. And that's, we asked people very simple questions. Would you be willing to go meet with a group of 5 people? Have you had people from outside your family in your house? These kind of things were like, it's not necessarily higher empathy, but higher empathy people were less likely to do these behaviors that they knew would expose others at higher risk. And then also we categorize, and that's just from the general correlations, but using the persona method that Michael's described, we also found, kind of like Michael was saying, you found empathy with the participants. And also I think that using not just empathy, but a group of different variables that we used, including these situational variables that I think, as much as we use demographics, we don't often think about how someone's employment type would affect their feelings, their empathy levels, their exposure, or their behavior in psychological science, even in mass population studies. That's not a variable that's coded often or looked at. But in this case, it turned out to be very important. And looking at those personas, you could see groups of people that, because they had high exposure jobs or because they were from demographic areas that were exposed both to more COVID, had less resources, and were less wealthy, engaging in higher risk behaviors. And not because they were doing it out of low empathy, but because of these other confounding variables that all were correlated with one another. So I think it's really important to measure other potential variables and then weigh them in when you're describing your participants.
Yeah, going off of what Staci and Michael are saying, like multiple layers to empathy, in addition to empathy for others, essential workers, etc., but also in public health messaging, being empathetic, having empathy for people's circumstances, even as a policymaker, as somebody who's making these decisions, especially in times of high uncertainty, can help people be more compliant or understand how adaptable they can be given the situation. So that's another layer of having empathy for the target audience can help actually advance the message that you want to send to the right people.
Yeah, and it's also interesting how empathy in this case is more than just like perspective taking, it's active action, right? So it's pretty cool. But I wanted to ask you guys a little bit more about policy implications of your work as well. So what are some of the policy implications of your findings, and what are some of the lessons learned from these topics?
Yeah, I think for policy implications in like kind of the like low hanging fruit stuff is that I think, and this could be more of like follow up analyses, but essentially, we identified that like, okay, here are the 2 personas that are the most likely to engage in, or not being compliant with quarantine behaviors. So by using those demographic variables that are associated with those personas, it could be possible to identify, like using publicly available like neighborhood data, for instance, to then maybe identify different neighborhoods or districts that might be higher risk if they're, more likely to correspond demographically with the personas that we identified as, more high risk. So there could be, at least even on a like implementational level, something useful in that regard. And then for policy, or I guess more in general, And I guess like I think that this type of research or this type of methodology could be incorporated a lot more often in a lot of other different types of whether it's public health or healthcare in general type of research of, I think a lot of people kind of talk about with their medical experiences that they're it's kind of like a one size fits all type of approach sometimes, or some people don't necessarily feel like their specific needs are being, kind of tailored towards them. So I think that these type of methodologies that really tries to capture as much variance of people and try to capture these interaction effects that usually, unless you explicitly know that there's an interaction effect, like in a regression model, like most of the time, like these types of interactions don't really get accounted for. So I think that there could be a lot of policy or even more effective policies if they incorporated more of these methodologies and trying to understand like where are people coming from and then being able to address, kind of the issue more at its root.
All right. So lastly, did your research findings also inspire any changes in your personal and professional life? And if yes, what are some of those changes?
So at the time, I think when this was all happening, March, I was also shifting into teaching over the summer as grad student. So you teach an entire course by yourself. So a lot of, like Michael and Staci are both alluding to, empathy, not just for other people, essential workers, et cetera, but also for these communities, like student communities, people that you're directly, in this case over Zoom, but interacting with and trying to account for that within when I was designing my syllabus and my course, understanding where they're coming from, what they might need as things are developing, understanding that they're moving home, they're not at school anymore. There's a lot of these contingencies. So kind of understanding the spread of the broader impacts of the onset of COVID pandemic. So I think that really made me think and reevaluate how I interacted with my students and accounting for what they needed at that time.
And Michelle, your class was on positive psychology.
Yeah, it was
so
on
much
positive
empathy.
psychology. Yeah,
like I remember
exactly.
every curriculum, like part of it was empathy, part of it was all of these kind of journal and meditation exercises, and students come. I remember hearing you be like, and they're coming to me and they're saying like even the things that they want to do, they're having trouble doing to help themselves, even if it's part of the course. So also just understanding that.
Yeah, definitely.
A big mental health impact, I think, on a lot of people. And that includes young people, and it includes a lot of people that we wouldn't normally see. I think what was really interesting about our population, and this was why Michelle and I had initially thought to use MTurk as kind of a comparison sample, and Michael helped us make it happen. Even if we haven't compared the samples directly, the questions asked were very similar to what we were asking students in a separate study at the time. I think what I'm trying to say is the MTurk sample, it was these people who we wouldn't normally reach, stay-at-home moms who were filling out surveys in Nebraska, nowhere near Philadelphia, like people who did it as kind of a side gig, people who were otherwise unable to work, and people who also just did this as a way to get money on the side while also working essential jobs. So I think it gave us a really interesting insight into who are these people, and also a much more representative idea of what, on the news, we were watching all of these very polarizing political things. And I think looking at the results the way Michael did was brilliant, because it kind of gave a face, so to speak, an anonymous face and a group kind of cluster approach, but to what these people were experiencing and why they might be motivated to act this way. So I don't know that that means it changed my life, but it changed my perspective a lot.
Yeah. And for my experience too, it definitely gave me, I think, a wider view of just, again, like the variability of how everyone is experiencing COVID-19. And there was, in a global sense, for sure, like even within like the same country, there could be so much variability in how much, people can, experience it.
Very cool. So thank you so much, all of you. Thank you, Dr. Chiu, Dr. Weiss, and Professor Haupt. For now, do you guys want to share a quick final closing remark for our audience?
Yeah, I think capturing how diverse how broad of a spectrum humans lie on can also help draw connections to other fields or other focuses that you might not have thought of, other fields that this method could adapt to. So between fields as well, this is very adaptable.
My takeaway would just be to be curious about not just the questions that you're asking and not just kind of the scientific view, but about why people might answer them differently. Just like retain that sense of innocence and curiosity about your subjects. And what's great about the method is it really lets the data tell the story instead of, does this adhere to hypothesis one? It lets kind of your data speak to you and direct you into new hypotheses and directions. And then it's really your role as the scientist to interpret those with the existing literature, rather than coming in with your own kind of assumptions and imposing them on your data.
I guess finally, a final thought, I think we mentioned this at the beginning, staying humble, even as scientists, we never could have predicted this to happen, but I was so grateful for Staci and Michael that they came through. It was a very isolating time. And so, like Staci also mentioned, collaboration, reach out to your grad peers. Everyone is kind of seeking the same community, and don't be afraid to reach out.
Yeah, that's a great note to end on. Thank you so much for your wonderful work.
Thanks for listening to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Follow the journal on Twitter at JCIH Online for news about the articles we publish and other resources. That's JCIH Online on Twitter.